So my name is Plumy Lawson, Plem for short. I'm known as Fit King Plem on Instagram. We are the owners of LVLUP Fitness Studio in Fort Lee. We also have an online version of that, as well as a fitness management option as well for commercial and residential spaces. We also have an app that's soon to be launched within a month, so that you'll be able to see that happen everywhere.
So my name is Shai Lavelle. I'm co-owner of LVLUP Fitness Studio. I'm also a physician assistant, specialized in internal medicine, but I'm at the gym full time mainly. And we've been growing our gym together for the past 3.5 years, I want to say. Been able to grow to at least, I've trained hundreds of women at gym. I only train women. Also own an activewear line as well. And yeah, right now we're grooming coaches to be us so that we can do other things.
I forgot to mention, I also have a Level Up Trainers Academy where I also, because I used to be an adjunct professor where I was teaching business courses at the Institute of Culinary Education for years. I kind of curated a special curriculum for trainers and coaches who aspire to be gym owners themselves, who don't have the fundamentals about business, sales, marketing, operations, just business creation, trademarking, setting up business accounts, working with accountants. So it's like an 8-hour course where I sit with trainers, and I literally offer this to coaches and trainers all over the United States right now. So I have trainers.
That's incredible.
I have trainers that have gone through the academy that are based in New Jersey, New York, Texas, Atlanta, Miami. So it's been growing over the past 2 to 3 years now. I have about at least 30 to 40 people that have gone through this, as well as small business owners as well. So they pay a small tuition, and then I'm just teaching them, and I kind of like their mentor, their guide through their business.
Can you, and Shai, I'm going to ask you the same question, but Plem, can you talk a little bit? You're a Jersey guy.
Correct.
I grew up in Jersey like I did. I'm originated in Hudson County, North Bergen, Jersey City, now in Bergen County. Can you just take us through your journey? Because, and Shai, I'm very interested, like physician assistant, athletic wear. So I'm really excited to get to your journey. But Plem, can you talk a little bit about like where you started and how you got to where you are?
Sure. So humble beginnings, New Brunswick, New Jersey is where I was born, raised largely in Somerset, New Jersey. Graduated 97, class of 97. That's just
same class
of 97. I did undergrad, Maryland Eastern Shore, where I actually majored in hospitality management and marketing. Got my graduate degree from Fairleigh Dickinson University. Also project management certified from NYU. I spent a large part of my years in corporate America, specifically in areas of HR as well as marketing. I was working for one company, Sendent Corporation, which is now known as Window Worldwide. So I was a corporate trainer, so I did a lot of public speaking. Travel all over the United States, all over Canada, to help general managers and new owners of those respective franchise learn the ins and outs, front of the house, back of the house, everything. So after so much talking and public speaking, I said, all right, I want to do something different. I ended up getting a role as a global program manager for a company called Leading Hotels of the World.
Wow.
So I got a chance to do some very expensive travel all over the world.
That's awesome.
But at the same time, based in the New York office. And this is just, a lot of the corporate background that I was doing. But during that time, mentoring youth, disenfranchised youth was something that's very important to me. Nod, shout out to my fraternity, Alpha Phi Alpha. I was volunteering as director of educational activities. So I was putting together curriculum specifically for young teens that maybe didn't grow up with dads, in the different outer boroughs, how to tie a tie, financial literacy, feeding the homeless initiatives, cleaning up highways, whatever it was that we wanted to impart to them so that they can be productive members of society, we were doing that with regularity. As I was simultaneously doing that, and this is, we're talking about maybe late 2000s, before 2010 get here, I had went and got married, I got kids. My first daughter was born, Deja, who's now getting ready to turn 18.
Wow.
That was like a big pivotal moment for me. But even before that took place, I had lost my mom to breast cancer.
Sorry to hear.
So yeah,
I lost my mom when I was young too.
yeah. So right before I graduated undergrad, she had succumbed to breast cancer, and that really reinforced to me, and because she really died young. She was only in her mid-40s, and it reinforced to me the importance of just health and wellness at large. It also reinforced certain principles to me in regards to just making sure you're a well-rounded individual that has a generous, giving spirit. I always attribute that to her whenever I'm doing it. It's like a nod to her.
Okay.
So as I was doing all of the above, in 2013, I kind of, I had this moment where I felt like when I was rushing into Penn Station every day, I felt like I was part of like cattle.
A suit and tie.
Yeah, every day. And
Yeah.
I had this moment where I stepped to the side in Penn Station and I just saw the sea of people
Yeah.
rushing up and down,
Yeah.
to mass transit. And I just was like, this doesn't feel so fulfilling anymore.
Right.
So at that moment, I decided that I wanted to be more entrepreneurial in the things that I was doing. So I had took all of my skill sets and all my education, and I said, you know what? The first thing I can do is I can sell back what I've already been doing to independent hoteliers, restaurant owners, bar owners, because I know some of them don't have the formal schooling. They might have just, stumbled into money, or they might have just, bootstrapped it and, came into this, but they don't have some of the insights that I have that I was doing at property levels from a corporate perspective, as well as on property.
Right.
So I started to do consulting
Okay.
at independent hotels as well as restaurants and bars. I simultaneously got invited and assumed the role as an adjunct professor at the Institute of Culinary Education. So I was teaching part-time, about 3 or 4 courses. One was business, math, accounting. Another one was like an intro class to hospitality management. One was food and beverage management, and the last one was HR. So
Wow.
I had all of this where I was kind of teaching from real life experience, hands-on experience, but also from textbook knowledge, et cetera, et cetera. In the midst of doing all those things, my passion for fitness, for my own self, never waned, no matter what I was doing.
You were always in.
Always.
That was always.
So from the time that I started strength training, when I told you at 13,
Okay.
I never stopped.
Okay.
And because of that, even through injuries, I had tore my ACL, and I just was like, I had a repair in my mid-20s. That never stopped. Like literally, people thought I was crazy because after I had the surgery, I went to the gym with my crutches and my
Wow.
brace on, and they were like, "You're not gonna take time off?" And I was just like, "The rest of my body is fine.
Right. Right.
This is just one area that's injured. I'm not gonna let myself go because of that." But my passion for health and wellness and fitness for myself started to grow where when social media started to take off, people were contacting me through my social media because they liked the posts that I was putting up in like 2013
Okay.
when it came to my own health and fitness.
Okay.
So as that grew and it grew to 1,000 followers, and I was like, you know what? Later for the jokes and the memes and, the personal pictures and putting up me and my kids and stuff, I just said, I can actually affect change with people if I start to tell them about my discipline and tell them about the journey that I take and how I see every day as a blessing, so that I press reset, so that mental wellness is important, so that physically it can manifest as well. So I started to share that and share little memes and words and things like that on social media, and just kept growing and growing and growing. And due to the networks and the different friends and corporate and all over the place and fraternity and everything that I knew, even some in nightlife, I ended up attracting different celebrities to me, different artists to me, and it just kept snowballing and growing. By the time I went and got certified and just really started to take it even more serious, even though I was multitasking at the time, I knew my calling was just to help people at large through their health and fitness, because it was undeniable how many times people were contacting me or just were inspired when they saw me physically,
Right.
even out in nightlife. So from there, I ended up started to do this like kind of online. So by maybe like 2017, after helping so many different celebrities and so many different people in so many walks of life, whether they were cancer survivors, whether they were people that, you know, were dealing with, you know, terrific accidents in their life where they were wheelchair bound or thought to be. I had all this eclectic mix of clientele that I had worked with. So I ended up putting together an online program. And the online program really took off to where in about 20 different countries, you know, people were buying my online option. So then I revised it and called it the LVLUP program in 2018. So by 2018, it really took off to where, you know, well over 1,000 people were on my online program.
Wow.
And I just was like, wow, this really has legs because, you know, I'm talking to people in Sweden and France, and I'm talking to people in different countries, and I'm getting on Instagram and chatting with them about their goals. And this was 2017, 2018.
Okay.
And I saw just the tidal wave of support that the brand started to get, and I knew it was bigger than me. So rather than, you know, call it, you know, Plem Fitness or anything else, there's some of other people that I knew that were in fitness, you know, they wanted that personal name on it. I say, you know, Level Up is something that's really universal. So let me just stick with that. And by 2019, I was introduced to Shy. And coincidentally, we were actually doing a YouTube video for a mutual friend of ours that wanted to film an outdoor workout.
Okay.
So he called me to come to the Bronx to film this. And when we originally met, you know, she was doing like a wheelbarrow drill with my friend Scott.
Okay.
So when we met, I just was like, okay, you know, I didn't even know if they were together at the time. So it just was, I was there to support and be a part of the video. But we had stayed in contact after that.
Okay.
And she started to come and do like little workouts with me and stuff like that. We just celebrated our anniversary of us being together, March 3rd. Yeah, it's been 5 years now.
You've been together for 5 years.
Yeah.
Work,
2020.
personal,
Yeah.
or both?
Yeah. So I'll let you answer that. You want to answer that?
That's a personal.
That's personal. So you didn't start working together till after that, though?
Right.
Yeah.
So I was a full-time PA during that time. I was doing all of the above and just, you know, level up and just coaching coaches and coaching a lot of people. And I had a contract to oversee the UFC gym. So I invited her to come over from the Bronx to come to Fort Lee. And she accepted. So we would do little workouts with each other. And we decided to go on a date. And we went to the movies. And then, you know, we hit it off from there. So, but the pandemic happened.
Right.
So all during that time, I call that a pivotal or a watershed moment, because it was like, either if you just started dating, the fact that you couldn't go out anywhere,
Yeah, right.
it was like that was a death sentence for some relationships.
Yeah.
Or it caused you to get closer because now you're creatively going indoors with each other and you were like really shut in. I got a chance to really learn how remarkable she was during that time, because, you know, she was on the front lines dealing with people literally were dying every day.
Right.
And she's so compassionate as a person. You know, she's coming back to her place, you know, holding all of that emotional baggage of having to tell families that their loved ones deceased and they wouldn't even be able to come in and see them.
Right.
During that period. So just hearing the horror stories that she had to go through, you know, I had this newfound respect for her and admiration, because I was just like, wow, you know, she's grinding out here.
Yeah.
But during that time, I also was grinding, but it was limited because of COVID.
Yeah.
So I said, all right, I'm gonna just focus on online training, and I'm gonna still help some people offline until this cloud is gone. Lo and behold, during that time, we started to sell weights. we got super creative. I mean, he was selling a lot of weights to people that couldn't get them online. And then when the contract was able to be executed on, because the state of New Jersey allowed the gyms to reopen in June, she started to come over, and she was helping me on the day she wasn't in the hospital.
Okay.
So we became like a very strong team with each other, because she's helping me with celebrity clientele during that time. And although we're juggling dating each other, we're juggling in its infancy, growing a brand together far beyond what we thought it could be.
Yeah.
And then we're also employing other junior trainers, if you will, to work under the brand in 2 different gyms. So we're grooming them at the same time. So it's like we're doing all of this, and then she's like, oh, and by the way, I'll be at the hospital for the next 3 days.
Right.
You know, when I'm off work, sometimes she didn't even go to bed.
Right.
She literally would do a 12-hour shift and then come straight to the gym.
Right.
And help me, you know, with management, with just the troubles I was going through from day to day.
Yeah.
So it became very apparent to me that, you know, this is something that she loved to do too.
Yeah.
You know, nobody would come and do this almost sleepless unless they loved it.
Right.
You know, no matter how much I thought she loved me, I'm just like, she loves helping people, because she could have just went to bed.
Yeah.
You know, why didn't she go to bed? And there's times I looked at her like, why didn't you go to bed? But she would come over, and then her clientele, like a supernova, it just grew and grew. And just from working with different celebrities and stuff, she became almost infamous in Bergen County as the person to go to for females of all walks of life, all ethnicities, to come to her, become inspired by her. So, I mean, she literally has fans, where she has legions of women that swear to come to her. They do her online stuff. They do her fit and fine classes. They come from all over the tri-state now. Connecticut, all over New York, all over New Jersey, even Pennsylvania, to come to her classes. She's been paid to do them in other regions. She's worked with Essence. I know I'm kind of telling her stuff, but
No, that's good. Third-party marketing.
yeah. I'm super excited about everything that she's done and what we've done in combination. So every day, like, we work tirelessly at this. And then we form creative partnerships with meal prep companies, and all types of different other brands want to work with us. So that's why we're super excited to even be here tonight, because we're like, we jumped at the idea of it, because I said, you know, this is fantastic to do bigger helps, because, you know, not only are you a PA, but we can go in there together and we can kind of bridge the gap.
Love it. Yeah.
Yeah.
I actually work with my wife from the day that I started working professionally. I mean, you're a PA, you know how the healthcare thing is. I'm in residency. You go to med school, go to residency. Residency, you're making like 35 G's, so you're barely. And then I got married to my wife the week after I finished residency. So you finished residency June 30th, July 11th. Wow. 15 years ago, I get married to my wife. My wife was like, by the way, very similar story, because she was a very successful attorney. She worked at like a top law firm. And we started to do this healthcare thing, and I'm like, starts growing. I start dealing with headaches that I didn't think I'd have to deal with, business stuff, all the stuff I hate, like payroll and like all this crap. And I'm like, do you want to come on board and just take care of this stuff? Because the legal background helps you with that. Like, it's like, you know, logical stuff. And then she came on board, and actually for the past like 15 years, we've been business partners too. She's worked with me to this day, right? She's one of, you know, she's our boss. And so, so I can relate to that.
Yes.
And people always say, I mean, I'm sure you get this. People are always like, yeah, but how is it working? And I actually work with family. Like, my brother's my business partner. Mohammed's like my brother. I got a lot of family. I got cousins in the business. People are always like, man, first, how do you work with family? I'm like, man, I have a very big family. So actually, most of them I don't work with.
Right.
Like you only see the ones I say yes to. I say a lot more no's.
Right.
But you know, there's something like, if I call Muhammad, if I text him at 3 in the morning, he doesn't flinch. You understand?
Yeah.
Because you need, at least for me, I need to know that I have a core that's not on the clock.
Right.
Do you understand?
Agreed.
And in healthcare especially, you know, I tell, you know, you don't remember, you could go to the doctor 50 times If you go 50 times Tuesday when he has a spot in his schedule, that's fine. You will remember the one time it was the middle of the night, you needed him. That's what you remember.
Right.
And so that's when it's most important. And you can't have regular folks that are like checking in, checking out, deliver that kind of thing.
Correct.
So that's that. And then with my wife, people are like, man, you work with your wife. I mean, you work with your wife. I'm like, listen, if you love what you do, if you love what you do, sure, there's times like I'll throw on the game and I'll peel back for sure.
Yeah.
But when I'm home, I'm just talking about work.
Yeah.
And if the person sitting with me is about it, they don't think it's, I hear people like, oh, this guy's wife complains, all he talks about is work and this and that. Yeah. So we're passionate about it. I think it strengthens our passion for each other. I think it brings, you have a mission in the house, we got kids, we got this, but it's there. And so I can totally relate to that journey.
You have a common goal.
Yeah.
And if it's something you're passionate about and you're improving other people's lives, I mean, I don't feel like there's a clock in, a clock out where you can't talk about it.
Correct.
Yeah.
And Shai, I want to ask you a few questions because in the wellness space, it's interesting. We talk, like I'm a doctor trying to get into what you guys are doing, right? With your background in hospitality and fitness, trying to get into what we're doing, but you're kind of born and bred in both. Like you actually did it. Can you talk a little bit about being a healthcare provider, like treating patients and then suddenly going into the gym? You did it. What was that like?
Well, in internal medicine where I was working, the majority of my patients were between the ages of, let's say, 22 to 105. And the majority of them were from 65 to 105. So I'm seeing a lot of patients who were literally, it was too late for them, on their deathbed, struggling, whether it was the complications of diabetes, the patients who went to see you and did nothing, right? Like went to see their community and didn't do anything. They didn't make the lifestyle changes. They kept eating, the unhealthy foods. They didn't break any generational curses. So those were the people that I was seeing. And I love what I do. I love being a PA. I became a PA initially because I wanted to serve my community and better educate the community, because there's so many people of color that it's just like a lack of awareness, lack of accountability. You know what I'm saying? Yeah. Even the newer doctors now are a little bit different. You guys are, educating your patients more. But back in the day, like, you were told you had diabetes. This is the medication you go on. They go home, they may take the medication, but they're still eating cake. They're still eating whatever, McDonald's and stuff like that. You know what I mean? So being on one end of that spectrum to this end of the spectrum where I'm able to, like, all right, she's 22, I can help her out. She's 35, I can help her out. You know what I mean? It's easy. I can mold them so that they're not those patients that I was seeing. So if I could just like stop people before they get to, to that layer point in life where they can't go back, like that's what I love to do. So.
Yeah, I agree with you 100%. I think sometimes I actually think that medicine, writing a prescription sometimes saves someone's life. I sometimes actually wonder, I really do, how much harm we do writing prescriptions, meaning even if you take all the people we help, because of what you said, when your grandma or whatever has diabetes and you give them a prescription, they believe now that's the solution.
The solution and the cure.
Whereas if you told them, listen, there is no medicine. The only way out of this is change how you eat, change how you move.
Yeah.
I actually think that in some ways, and I'm not denying medicine saves a lot, like I'm not denying that, but in an odd way, I think we have to evolve to the point where medicine is really moved to the back of the bus. The problem is easy fix, you know the drill. And then, so you went from taking care of patients when they're sick to being in the gym business and preventing them from getting sick to now you're in the clothing business too. Can you talk a little bit about that?
Sure. I had always knew, like, once I had got into fitness, that I wanted to sell Activewear because I love feeling good when I work out. If I don't like how I look in my outfit, then it's not going to be a good workout. So I wanted other people to feel that way too.
Okay.
So I started off with selling accessories. I started selling ankle straps for the cable column to do like kickbacks, because you go to the gym and there are no ankle straps, or everyone's sharing the exact same one. You know the ankle straps.
Yeah.
So I started selling those and knee wraps. So when I'm squatting, I could protect my knees and I can go heavier. So I started selling those too in 2021. I didn't start really diving into the activewear until 2022. And I started off small. I mean, I don't own a store or anything. I sell the activewear out of my gym and I sell it online. It's called Shop Body by Shy. And yeah, I sell, I mean, our clients, they need activewear. So
And that's what you're wearing right now?
yes.
All right.
That's one of my,
And that's the logo? Is that the logo?
yes, I have it on here.
Yes.
Yeah.
Baby
Body by Shy.
Body by Shy. All right, cool. Yeah, I love it. It's great. Yeah. I mean, now it's interesting how that's gone. You know, in our locations, our doctors and our team wear activewear. That's what they don't wear scrubs.
Everybody wears
They don't wear white coats. That's what we wear, right? And I mean, people come in now, like even like to the office or whatever, and so it's fascinating. Like it's crazy. Like I worked at the largest healthcare company. Now like it's a little United Health at Optum. I work there, and the CEO. This is the largest healthcare company in the country. All right, and it's like the 5th biggest company. And when I started there, the guy running it, who was my boss, wore a suit and tie. When I left, like the last 10 meetings I was in with the boss, like zip up, quarter zips, like athletic wear. So it's really interesting how now, I think it's a good thing because it's infusing the concept of wellness as something that's not just when you check into the gym. It's kind of something that just permeates through your existence, right?
Absolutely.
So you could always go for a walk, always break a little sweat. So I love it. I think, you know, and I've never been a tie guy, never. Like, I feel like, you know, you said how you want to look good so you have a good workout. If you don't look good, you don't have a good workout. Me, even if I go to work, anything I'm doing, if I'm not comfortable, if I have to worry about like this, that, if I'm in a meeting, if I'm trying to come up with ideas, it kind of cramps my style.
Right.
So I think like how you feel, what you're wearing, it's all fluid. It's not separate.
Patients feel more comfortable.
Correct.
If you're in those type of clothing.
Yeah.
You know, they get white coat syndrome, they get nervous, they get the blood pressure
Yeah.
elevated. So it makes them feel
Yeah.
more comfortable to have like a genuine conversation with their provider
Yeah.
versus like an interview.
Yeah, yeah.
I love that.
I feel that 100%. As a pediatrician, I take care of kids, so it's an easy sell. Like parents actually dig it because the kids are disarmed.
Right.
They love it.
Right.
There's very few. Now, sometimes I find that when patients are older, they want to see somebody with a suit and tie.
Right. Old school mentality.
Correct. I think sometimes though, when you sit with them, you connect with them and you care about, like my brother, he's an adult doctor. He's even less of a suit and tie guy than I am. And his patients love him, right? Because he connects with them, he takes care of them.
Right.
So I think there's this paradigm shift. It's slowly happening, right? And I think what you guys are doing is kind of at the tip of the spear. Like just your journey, like listening about how you came from like your hospitality, your corporate background, you leverage that. Your background is probably the most unique I've heard, and you're bringing it all together. I think it's not surprising. You've had the success you've had. I actually think you're gonna do a lot more. Like it's such a it's like when you have these unique
That's how we
spices.
feel. We feel
you're
like
gonna have the best dish in the world,
We're at
right?
the tip of the iceberg as far as the things that we're going to do.
You're just getting started.
Just getting started. That's how it feels.
Good.
So we're super excited because as I was mentioning, with some of the technology that we're going to be leveraging, we'll be able to expand what we do and help a lot more people, employ a lot more people, and ultimately just have a bigger impact, to Shai's point, to where, you know, you're helping your communities, you're helping people of different walks of life. Because, and I got goosebumps just listening to you because yesterday I was on a TV program where I had to do a Zoom for street soldiers. And I was literally talking with Irv Gotti's brother, Chris Gotti, who was on the platform with me, speaking about the disparity in like black men with having strokes. Because obviously, you know, Irv Gotti recently died of the stroke. So the panel was there, and we were having a really, really good discussion about just what happened with him, but then also the prevalence and sometimes the indifference of people just wanting to take care of themselves and waiting to the last minute or putting all the onus on the doctor.
Yep.
And, you know, I was just really hammering down the point of accountability and discipline and self-discipline and self-love, and having habits that steer you from having to go to the doctor.
Correct.
You can't for 364 days ingest trash and hardly move and then think when you go to the doctor that they're going to fix it.
Correct.
That's not even sound thinking mathematically. It just doesn't add up. And we have to take accountability for that.
100%.
As opposed to pointing the finger about the Medicare system or this or that or anything. Unfortunately, Chris, he unsuccessfully wasn't able to get his brother to stop eating bad. You know, the Chinese food, the this, the that, you know, the drinking alcohol, etc. Those habits has stayed with him. And if you look back and if you know anything about Irv Gotti and his journey, even from teenage up, he was overweight.
Yeah.
If you looked at his face and if you looked at, you know, during the time that he was making beats and DJing and doing stuff with Jay-Z and Ja Rule and DMX, like late 90s and early, he still was overweight.
Yeah.
So his path to diabetes was happening in small increments every single day in his life.
Sure.
So to wait by the time you're in your late 40s, the compounded effects of doing that. So we had a very spirited conversation about it, but I was really echoing the sentiment of living each day, you know, at a micro level, appreciating your health and wellness and spending that 1 hour, that appointment with yourself to give back to yourself as a privilege.
Right.
It's not a punishment.
Right.
And whether it's outdoors, whether it's indoors, whether it's in a gym, no matter where it is, you owe that to yourself because you don't want to take your life for granted.
Yeah.
So by the time I finished having that discussion, I think I was able to successfully hammer that point down, because I don't know if they thought I was just gonna come and talk like a meathead and talk about weights. And I'm just like, no. You have to have an appreciation for your life at large, and you can't put the onus on a doctor.
Yeah.
You know, whether they're Western medicine, whether they're holistic, prevention is better than cure.
Yeah, 100%. And
But every fan, you guys. I had a woman come to me, sorry to go about the other day, and she was overweight, and she said, my doctor said I'm overweight and I'm pre-diabetic. I said, the doctor didn't need to tell you that for you to know that. Just take accountability. Yeah.
Right.
Like, that's what's going on in the community.
Right.
Same thing.
yeah.
We're dealing with it every day.
You know, you might know this already. You know, now in like some of the medical societies, maybe it's been like a year or two now, they're telling the doctors, you shouldn't take the patient's weight. You heard about this?
Shouldn't take the patient.
Patient's weight in the office. You could look this up. So they're saying, listen, you shouldn't take the weight because it makes them feel bad. It's, I forget, not fat shame, some version of that.
Okay.
And you shouldn't do that because it makes the patient feel a certain way. And it got legs. It actually got legs in the medical community. And
Interesting.
yeah, look it up.
This is
And I try to, you always want to be humble. You always want to be thoughtful. You always want to be respectful. The only thing, look, I've been doing this for 17 years. The only thing I know for sure, there's only one thing, is that what I know now is going to be different tomorrow. So I have like I try to maintain a deep humility about like knowledge and stuff.
Right.
But when I heard that, I'm like, listen, I'm trying to figure this out and hear what you're saying. But like, in the end, I actually think the biggest disservice we do is when you kind of pretend things are okay. And you talked about Irv Gotti, you talked about this, that. Folks like that are surrounded by people that love them.
Right.
The people around them don't love them. It's not that people don't love them, it's that we confuse the messaging of love. Like, if my wife loves me and I'm eating crap and I'm setting myself up for failure, not offending me in the moment is not the best demonstration of love. The best demonstration of love is me like, Z, listen, man, you're screwing up, blah, 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 blah.
That's right.
And it's better to hurt in like for an hour
Right.
instead of hurting for like decades.
Correct.
Right? And I think whether it's doctor to patient, whether it's, you know, auntie to whatever it is, to have that conversation is hard. It's easier to be like, yeah, no, dude, no, it's all good, man. Cheers. It's all good.
Great. It's okay.
Yeah. So I think that point about giving it straight, there's ways to do it empathetically, there's ways to do it respectfully.
Correct.
But I think doing it and not looking past it, and then pushing back against this notion that I think there's what I see when I take care of patients, there's two problems. One, thinking that the prescription pad is good. I tell the patients when they see me, I always tell them, I'm like, avoid doctors and drugs. Avoid doctors and drugs, okay? If you're going to the doctor a lot or you're getting a lot of medicine, that's not because you're doing a good job and you're staying healthy. A lot of people think, well, I go to my doctor and I get this and I'm on these medicines. And I you know what? I take my medicine every day. I'm like, you want to get off the medicine every day. And then the other thing is what you said, which is thinking of your health as something that's episodic instead of something that's routine, right? You have 3 meals a day. That means you're affecting. Those are 3 doctor's visits a day, whether you know it or not.
Yeah.
Those are gonna affect you or hurt you more than the doctor's visit, right? Your relationships, stress. Like we didn't even talk about relationships. A few years ago, I heard someone talk about like a vital sign. Remember, they tried to make pain one of the vital signs. I heard someone say, you know, your relationship with vital signs, and I would roll my eyes in the beginning. And then the more I thought about it, honestly, I'm like, you know what? If I'm with like my people, if I'm hanging out, working with my people, I come home, I'm like, that affects my mood and my disposition and my health more than anything, right? And if you're in a toxic relationship, if you're like working with people you don't want to be with, if you're home with people you don't want to be with, that releases the wrong hormones, it gives you bad vibes, and it affects you. And so I really, really believed, I want to end the conversation the way we started it. I honestly think that the new primary care providers are you guys. I really do. I think you guys are the ones driving the car. I'm somewhere in the back seat, so when things go wrong, you're like, hey, there is a stroke, there is a tumor, whatever. We know, and I hope that the people that listen to this or watch this understand that you guys are the co-pilots. I'm in the back, and the pilot, the guy driving the car, is for their health is the individual. They have to own it. They're the ones affecting their health on a day-to-day basis and take extreme accountability. So I want to thank you for making the time. This was a great conversation.
Yes, it was.
I really appreciate it. And I look forward to seeing all the magic you guys are going to do.
Thank you.
And I want to be a part of it.
Thank you.
You're going to come back.
Oh, you know, we're locked in now.
Great, man. Hey, thank you for making the time, Shai. It was a pleasure to meet you, okay? Thank you for the time. Appreciate it.